I'm here to present the practical methods to control cybersecurity, and I know we will talk a little bit later on specifically on the landscape for the healthcare sector. But I just want to start by highlighting some key findings of this year's ISAC report. It's based on a survey from a total of more than 2,000 respondents from companies worldwide and focuses on the threat landscape, reviews security trends and themes, and also emerging areas, including the application of AI-enabled security tools. The first finding is that attacks are still increasing, but with some leveling. Attacks continue to increase, however, data suggests a slight downturn or leveling in the rate of the attacks compared with prior years. The second finding is that security functions are scattered within IT operations. It's not surprising that many security functions, including the incident response, maintaining, updating, or implementing security tools and systems, are still performed by IT operations. The third one is that cybercrime remains underreported. Probably this is the most problematic finding. A total of 41 plus 21% of professionals believe that enterprises are failing to report cybercrimes, even in situations where they have a legal or contractual obligation to do so. The fourth one is that AI solutions may increase visibility, though the adoption lags for the machine learning and artificial intelligence. But it's already relevant that organizations that use machine learning and or artificial intelligence solutions appear to have increased visibility into attacks. Although it may be an early in adoption curve, and the outlook is promising based on these positive signs. The other two findings that I don't have a picture for that is that the one is already known, the lack of staff and oversight impacts operational performance. So understaffed security teams, along with those challenged in acquiring new staff, are significantly more likely to have experienced more cyber attacks. And oversight of the security function and reporting structure also correlate with the security performance. And the last one is that ransomware returns as a primary post-exploitation monetization strategy and surpasses cryptocurrency mining as the primary monetization strategy post-exploitation. So hospitals, IT teams have a lot to worry about, and the constant struggle to stay one step ahead of attackers can be exhausting. Overwhelmed by daily fires, dealing with slow, inefficient processes and cumbersome firewall and antivirus management, healthcare IT professionals are having more than ever stressed times. Which is why mapping out a smart, well-structured plan for protecting your organization's critical assets is so important. So what should we do? Tip 1, short-term tip. Identify your connected medical devices and critical assets. So every hospital needs visibility into which of its devices are IP addressable and how they are interacting with the network. It's important to create a comprehensive and easy up-to-date inventory map of all the connected devices deployed across the hospital. Tip 2, do risk assessment. We already talked about in a previous session. Is very important to assess the risk and establish an operational and technical framework for this risk assessment. An effective cyber risk management starts with the awareness. And after that, after you have taken in a broad panoramic view of your security apparatus and after achieved a good understanding of how it relates to and intersects with network medical devices, you will want to begin to make improvements as we saw previously. And a concise and actionable risk assessment for every identified medical device enables our IT security professionals to prioritize threats. A deep understanding of how medical devices and clinical assets mix up with existing protocols, controls, and network security architecture is also very, very important. Tip 3, also a short-term one, define your behavior baseline. So roll out detection mechanisms and measure operational baselines in order to capture what normal traffic looks like. Once your medical devices and clinical assets have been identified, contextualized, and analyzed for risk factors, to get out ahead of cybersecurity issues in healthcare, you will want to measure operational baselines in order to capture what normal traffic looks like. If the ultimate object is recognize, predict, prevent, and respond intelligently to malicious traffic, this is imperative. All network traffic should be continuously scanned and processed, and automated alerts should be configured. To that point, it's recommended that you make sure that your security monitoring and management processes incorporate push notifications, alerts, IT data, and solution-derived cyber insights into a single CM, security incident and event management system. Tip number 4, probably one of the most important, train and educate, do staff training and prioritize widespread knowledge transfer about risks, how to recognize them, and what to do when an incident arises. While the deployment of technology is critical, healthcare providers must also train IT and security personnel, as well as all employees who have access to these critical assets. The importance of proper education and communication across the entire organization from top to down cannot be overstated. These are the 4 tips for the short term. For the medium term, you should proactively reduce the attack surface. What is it? Hospitals have multiple access points, so IT professionals must try and reduce it by building a well-thought-out defense architecture. This can be achieved by leveraging existing IT and cyber solutions, segmenting network zones, blocking activities or access ports associated with high-risk level vulnerabilities, and constantly reviewing security policies, controls, and procedures. Hackers, as we know, are continuously improving their techniques, so it's critical for hospitals to make sure that their security controls and policies remain one step ahead. This means that refining not only your ability to detect events and alert your team, but to combat malicious code or maybe illegitimate network connection attempts, do this in real time, and to proactively or preemptively defend against the specter of an attack. As they say, if you are only reacting to attacks, it's already too late. Tip 6, build an automatic near zero configuration, zero manual maintenance security architecture. So automation reduces manual labor required of IT and security teams, and helps drastically to reduce the scope of human error. Our hospital IT teams typically struggle to keep up with an overload of work, and this type of smart automation is also critical to help alleviate that overload and maybe reducing the overall TCO. Tip number 7, establish an incident response protocol. So implement a cybersecurity incident response team. Cybersecurity incident response is essential for effectively handling a coordinated response, both technically and organizationally, to events and incidents. Hospitals must prepare and document response planning, triage and containment strategies, decision-making and communication priorities, as well as a recovery process. Tip 8, understand regulations and standards as they pertain to your medical devices in critical assets. So hospitals must gain an in-depth understanding of the wide range of regulations affecting all the medical devices and their security. So from IPA to ISO, specifically as we talked earlier, the 27799, or from ISC standards to GDPR, the compliance landscape, it's a complex one that deals not only with data privacy, but we should not forget that also deals with the patient safety and business continuity. You need to take a step-by-step, you should take a step-by-step approach by focusing first on the most fundamental tasks, but compliance definitely should be one of them. Set expectations, address the technology and controls needed, and establish a good security risk management processes. For instance, the one that we saw earlier. Tip number 9, establish patch management processes. As Dimitri told, the procurement process, during the procurement process, it's critical that vendors be held responsible to provide the security updates and the patches for all devices they sell. You should make sure that these considerations are reflected in purchasing requirements and vendor service provider contracts, while taking care to specify expectations within the RFI or the request for proposal, bid, or other similar documentation. Also, CISOs and senior IT managers need to understand what's at stake and where the sweet spots are. Accordingly, they should influence the bidding and the procurement process with the aim of ensuring that there is a built-in and serious assessment criterion for the suppliers. The last one, but not the least, it's very important to collaborate and work towards an atmosphere of continuous knowledge sharing. Leverage threat intelligence and experience from your peers, such as, for instance, other hospitals, as well as share individual experiences. Diligent security manager should look to collaborate with other industry organizations such as ENISA, NIST, and of course the national CSIRTs. So basically these are the top 10 tips that I consider the most important. I hope that it has been useful, and at least that keeps you aware about what are the real priorities and what should you do to control cybersecurity. Thank you for your time.